put Dr. Washington on here. We'll wait a few more minutes for others to join, and then we will get started.
Jen, were you able to figure out how to record?
Yes, I was able to. We are recording now.
Okay, cool.
Yep. All right. Can you see Dr. Washington as he's sitting down?
Yes.
Oh, it's so weird because I can't see
Okay.
him.
I know. I was seeing myself right there, but I'm not seeing you anymore.
Can you hear me?
Yeah, I can see
Hi,
you.
Dr. Washington.
Yeah, hello. I think if I'm going to do this here, it looks like I'm looking at the screen, but I'm still looking at this.
So far we have 6 participants. Okay.
More people are showing up. I'm admitting them as one at a time. There we go.
Oh,
Waiting on a few more people.
Yep.
And we'll get started in a few minutes. That's good.
Hello, Mariam.
Hey, good morning.
Hi, everyone. Good morning or evening at this point.
Yeah.
Hi, Miriam. Hi, Mariam Joale.
Hello. Nice to meet you. Good to see you.
Hi, thanks for joining us. There's sirens.
Hello, everyone.
Hello.
Hello.
Hi.
Hi.
Good afternoon.
Good afternoon.
You see one person joined us.
What'd you say, Catherine?
I see someone joined us through a phone.
Yes, there is someone on the phone.
Okay.
Hey, just one more minute, if we have anybody else, and then we'll get started.
Hi, how are you, everybody?
Hello.
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 Hi.
Hello.
Hello.
Okay, one more person just joined us. Cawthor, I think I'm going to let you start. And if you want to introduce yourself and Dr. Washington.
All right, okay. Someone is calling me, he has technical issue. So I think we're good now. We're gonna start it.
Sounds good.
All right. First, I want to thank all of you for joining us this meeting. We appreciate for your participation. The purpose of this meeting is to discuss the importance of immunization. We are all invited you because we felt that you had the understanding of what is needed and the vision to create something much better than what our organization know about the immunization and the Somali community. Therefore, before we start, I will give everyone who is here to introduce his self. Just say your name, the organization you're presenting, and yeah, and then we'll go ahead.
Oh, they're probably home.
Okay. Good morning, everyone. My name is Mariam Duale. I am with Global Health and Education Development. We are a nonprofit organization that provides health and education access to underserved communities here in Central Ohio. Thank you.
My name is Hassan Omar, and I am the president of Somali Community Association of Ohio. Actually, we are a neighbor not far from where you're at, and we help the Somali community for the state of Ohio. We are a statewide organization, and we've been providing the service for Somali community for the last 22 years. So I'm happy to be here and to join with your group today.
Thank you, Hassan. Thank you, Mariam.
Hello, my name is Abdul Haji. I'm with Diligent Healthcare Service, and we provide home health for elderly people and anybody that need our service. And we provide the state of Ohio all the home care that we need. Thank you, everybody.
Hello, my name is Lula Ahmed. I'm a clinical research at Nationwide Children's Hospital. And also I'm a community advocate and community outreach. Thank you all.
Hi, everyone. This is Miriam Ali, and I'm a community health worker at Celebrate One, serving the North Side area. Oh, I'm sorry.
Thank you, Mariam. Thank you, Lul. Anybody else?
Good afternoon. This is Donna Gabbard. I'm Director of Women and Children's Health for CareSource, one of the 5 managed care plans providing services to Ohio Medicaid recipients. And I'd like to say thank you for inclusion in today's conversation.
Thank you.
I'm William Washington, Chief Medical Officer for Heart of Ohio Medical Centers, and it's my pleasure to be here.
Hello, my name is Crystal Smart. I work for Buckeye Health Plan. I'm a part of the immunization statewide initiative along with Donna, and I'm just so thrilled to be able to share this time with everyone.
Thank you, Krista. Is anybody else remaining?
I'm Jen Schell. I'm here with Dr. Washington. I'm the Director of Marketing and Development for Heart of Ohio Family Health.
Hello, my name is Jenny. I'm the Marketing Coordinator at Heart of Ohio Family Health. Pleasure to be here, and I'm so excited to hear what you guys have to say.
Hello, I'm Sheila Spites with Buckeye Health Plan Community Relations Representative.
I think we may have gotten everyone, Author.
Okay, all right. So we're gonna start our presentation today. Before we start, I would like to introduce I would like to introduce you Dr. Washington. Dr. Washington has served as a Chief Medical Officer for Heart of Ohio Family Health Center since 2015. Prior to his career at Heart of Ohio Family Health Center, Dr. Washington practiced as a physician in various capacities. For over a decade, he owned and operated his own private practice in Columbus, Ohio, where he served a large number of minority, Medicaid, low-income, and non-English speaking patients. Dr. Washington is a member of the American Association of Family Practitioners at National Medical Associate. Dr. Washington, welcome to the microphone.
Thank you. Again, it's truly my honor to be here. As was said, I'm part of Heart of Ohio, and I've been here for 5 years, and I'm honored to do this presentation. Just want to say a few words about the importance of receiving timely immunizations in our communities, especially our children. And again, especially our children. Significant morbidity and mortality occurs in our communities every year due to inadequate vaccination rates. The goal of immunizations is to achieve something called herd immunity in our communities, which basically is vaccinating enough people to where the virus or pathogen, we may speak, has no place to spread or go to. It is a major concern in our communities that these vaccinations cause significant, widespread morbidity and mortality, possibly, including autism. Extensive research studies have shown that this is just not true. Typical reactions include mild fever, malaise, and injection site soreness. There have been rare cases, and I do mean along the odds of 1 in 100,000 of something called Guillain-Barré syndrome, which is a chronic viral infection. But again, no studies showing any increased incidence of autism in our communities. Please help our community to be safer by receiving all recommended vaccines. One of the vaccines that's received is a vaccine called Measles. And this vaccine, this virus, is extremely contagious to the point where one could be in a room with measles for just a very short period of time, leave the room, and then someone could walk in the room and develop measles just sheerly from being in the room where that patient was located at. There have been episodes of breakouts of measles in low vaccination areas. I'm just going to talk about a few other slides I wanted to show you. Okay, great. So we'd like to talk about some of the services that we offer at Heart of Ohio Family Health Care Center. We We use well visits, we do immunizations, we have chronic care management of disease states like diabetes and hypertension, which are very prevalent in our society, causing multiple morbidity and mortality. We take care of acute injuries and illness. We do lab testing on site. We have a behavioral health and substance abuse disorder counseling center also. We do centering of pregnancy. We offer OBGYN services, and we do counseling on sexually transmitted disease. We have a nutritionist on site along with a pharmacy specialist that specializes in the care of diabetes and hypertension patients. We also have community health workers on site to help with community issues that we have in our community. Our current sites are Capitol Park Medical Center, where I see patients at 3 days a week, Whitehall Medical Center, and then we have a new location coming soon. We also are at Whitehall Yearling High School, and we have a women's health center located at Mount Carmel East Hospital. It's just essential, absolutely essential, that well child visits that are done once a year at least. Studies have shown that this makes this helps the bottom line as far as keeping our kids safe and healthy. We are taking extra steps, as we have done since the pandemic started, to keep our patients and our staff safe. We follow all the guidelines from the CDC as far as hand washing is concerned and maintaining safe distance for patients. Multiple studies have shown that vaccines are safe and they are effective at preventing serious diseases, which is very important in our community. It's important for all of us to stay up to date on our vaccines, and again, see our doctors, our nurse practitioners on a regular basis, at least once a year. Even with vaccines, even with the presence of vaccines, preventable diseases are still a threat. And so again, it's important to be vigilant in seeing your doctor if you do get sick or you have symptoms of illness. And then this is just what it looks like, what we look at as far as when we see patients, as far as looking at what vaccines they require and what services that we provide to our families and our children. Any questions, guys? Okay.
Anyone has a question?
Yes.
Mm-hmm. Please go ahead.
Oh, okay. Okay. Well, thank you so much. Again, it's my honor to speak to you today, and thank you so much. And we're always hoping we can make a significant difference in the community. Thank you.
Thank you, Dr. Washington. And I see a few people chiming at us. Please, can you introduce yourself before we started the questions?
A few people joined late.
Hello?
Yes, if you could just introduce yourself, let us know.
Oh, okay. So are we unmuted right now? Can you guys hear us?
I can't see you, but I can hear you.
Yes.
That's great. Okay. Hi, this is Hogan from our house group.
Welcome.
Okay, hold on.
Thank you.
Okay.
Hello?
Yes.
Hello.
All right. Okay, so we're gonna go ahead, and we have community leaders from different sectors. We have here today community businesses owners. We have community leaders and also the research leaders. So I wanna give a minute Hassan Omar, who is a community leader, to say a few words about the immunization and the concept of Somali community.
First of all, thank you for giving me opportunity. I really, I'm aware of the immunization is one of the critical state, issues that the community been affected. And we've been working with health departments throughout the state to educate the Somali families to accept the immunization, because where we came from in Somalia, the immunization was not necessary and sometimes was not available. But here in the United States, in order for the child to be to attend the school, it's required to have the immunization, and we know that. So this is very important, and as a Somali community, we need to encourage parents to actually take their children to the Columbus Public Health, or if you have any facility, because this is a requirement, whether we like or not. And I'm encouraging everybody to go back to the community and share the information and importance of immunization, because this is prevented from chronic diseases. It prevents from, I say, all the diseases. So I am personally, I've been encouraged, and today when I get this invitation, I really felt that this is one of the important things that the community needs to share and disseminate throughout the community. So thank you for inviting us, and we are here to help.
Thank you, Hassan Omar. We have also Hodan, who is a community leader and non-profit organization. Hodan, please join us if you want to say a few words about the immunization. And are you hearing me?
Yes, Coco, I can hear you.
Go ahead, please, and say something about the concept and the immunization about the Somali community.
Okay. Hi, everybody. My name is Hazan Mohammed. I work with a nonprofit organization called Our Health Chris. We mainly work with immigrant community, specifically Somali people. This is a big topic, and I'm glad we're coming together to talk about this. I have not much to say, but all I know is there's can you hear me?
Yes, I think if you're not speaking, if you could mute your phone, that would be helpful.
I think somebody's on the phone.
I think so.
Okay, all right. So I'm glad we're coming together to talk about this. There's a phobia about immunization when it comes to some community, specifically when you have a second language, or English is not your first language. I have a couple people that call me and say like, hey, my son or my daughter has doctor's appointment. I don't want them to take this. What is your advice? I'm not from medical background. I can give them advice. So my main request will be like, let's do a community education as much as we can, just like this one. Talk about this, answer their questions. There's a lot of translated stuff, but there's a lot of people that don't read Somali, and maybe they can read it, but not as fluent as they can read pages of information. audio is always the best. They can listen because they do understand. Whenever they listen, they understand. It does not matter what dialogue it is, but if you are told to read, it's really tough and hard, might not understand all the information. The translation is word to word, which sometimes does not even make sense. Some documentation is a Google translation, which does not make sense. So audio translation will be the best, and that's my advice. And thank you so much. Sorry for taking that long.
Thank you, Hodan. And also we have Mariam Duale, who is also a nonprofit organization director. Mariam Duale, please, can you say your understanding about the maternal perception of childhood vaccination?
Hello, everyone. Thanks, Kausar, for inviting me and for organizing this important discussion. Can you guys hear me?
Yes.
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 Okay, great. So I'm a public health specialist, and I've worked quite a bit with immunizations in Somalia, not necessarily here, but I also used to do medical interpretation quite a long time, and have had a lot of questions raised by families about immunization. So I think the community, as Hassan and Hodan and others before me mentioned, we have cultural difference that our community's background does not align well with immunization, so they need more education and more people of that they recognize advocating for immunization. The biggest questions that I got about immunization is one, there is a discussion that it causes some sort of autism. So the role of immunization and mental disabilities or things like that need to be, there is a misinformation out there. And right now, I know a lot of young mothers are opting out to do immunization with their kids when they're young because there are community stories and things like that. And it's not just with the Somali community. A lot of people do believe there is some association, and it needs to be taken into account when we're making promotions for immunization. Another thing is the content of some immunizations. Some of them use content from pork, some sort of like pepsin or something is added as an ingredient. And also some people don't want to take it because of that. So we also have to make sure and preemptively clarify if that's the case. And if that's the case, we need to find immunizations that are free of animal product that can be sold or engaged with the Muslim community. And so, yeah, we're a public health organization, and we're willing to circulate and advocate for immunization. So if you need help in that regard, let us know. Thank you.
Thank you so much, Mariam. Thank you for sharing with us all the information. It's really very helpful. So now we have a few more questions. We will open up our discussion. So if you know the answer, please jump in and say how you think about it. The first question is what do you see as a barriers to children aged from birth to 6 years in your community receiving immunization? Do you feel like the barriers are related to culture, language, transportation, or scheduling times, or the trust between the doctors and the patient?
Hi, hello, my name is Lula Ahmed. To answer this question, will be, I think number one, it will be trusted the doctors. Parents should be trusted the doctors. Doctors should be educate or give something to understand parenting when they're giving the immunization.
Hello?
Yeah, can you hear me?
You went mute.
Yeah. Can you say
I was
again?
muted.
We missed your voice.
Okay, can you guys hear me now?
Yes.
Yes.
Okay, my name is Lulbi Ahmed. To answer the question, I will pick number one, will be the trust to the doctors. So the parent should be trusted the doctors, and doctors should be educate the parent, because if they don't give any education, why do they give the immunization for their kids? It will be hard to understand it. There will be a different, of course, immunization that kids will take during this kind of age. It should be between 4 to 6, or most of the immunization that they scare the community, like they will receive their child. And they have a phobia, some of the immunizations such as MMR. So that way, if they just give it to them, and we already have word of mouth that's saying like, oh, if you give your kids this immunization, it can be having challenge, not speaking, or might having some other type of the kids might be developed. So to avoid that, I believe it has to be awareness that the community needed, and education through between the providers and the parents. So that's number one. That's the big keys. They have to trust and they have to receive. And also culture. They have to understand the culture and how the culture is belief. I think the barrier will be the cultures too.
Thank you, Lil. Thank you, Lil. Who wanna else chime in and answer this question? If I say one more time, what do you see as a barriers to children in your community receiving immunization? You can choose either culture or language, transportation, schedule and time, or trust of the doctors.
This is Marian. So I don't think it's just one. I believe, like Lou mentioned, there is multiple issues that can impede on these kids getting immunization. But I would say the biggest issue will be cultural competency and access to information. So we can only make choices with what we know. And so if the parents, one, as Lul mentioned, they don't trust their provider, and second, if they're not receiving adequate and culturally appropriate information to make decisions with, they won't be able to make the right decision. So thoroughly understanding the target audience, understanding the barriers, and educating based on that, I think will be the key. Thank you.
Thank you, Mariam. Is anybody else has different answer? All right, thank you guys. We will go ahead and ask you the second question. We know COVID-19 has affected everybody. So this question is regarding the COVID-19 and immunization. So before the COVID-19, how will you prioritize immunization for your children or for the children? Let us say high priority, medium priority, or low priority. Because the idea we need to compare between before the COVID-19, how the process was going for the immunization, and before after the COVID-19. So before the COVID-19, how will you prioritize immunization for your children if you have children?
I want to chime in, Kausar. I don't have children that are getting immunization right now, but I work with a lot of mothers with young children.
Mm-hmm.
And before COVID, I think they had a good priority towards immunization, but right now people are even scared to go to the doctor. So I have people that I asked to get kids medical forms for us, and they're saying, can we wait until the COVID? And I know these kids are due for their annuals, and I have had discussions with them about their immunizations are due, they need to see their doctor, and they're saying, well, we're worried we're gonna get COVID from there. So I had to explain and call some doctors, and they explained they had to stay in their vehicle and the contact is limited. So I think right now people are a bit apprehensive than they used to be with getting the immunization.
Right. I agree with you that I believe that COVID-19 has affected the process of the immunization as well. So is anybody else has different answer? All right. Okay. So let me say one more time. Since the COVID-19, how will you prioritize immunization for your children? You can say either high priority, medium priority, or low priority.
And I just want to broaden that just a bit, and not just your children, but how do you think the Somali community are prioritizing immunizations during this pandemic? I think Miriam already commented, most people are afraid that she's encountered. Does anybody have anything different experiences or similar?
Why am I stuck? Shit.
Hi, so this is Miriam. I will definitely echo what Miriam Dolly mentioned in regards to the apprehension. And honestly, just think of it yourself, like we have different priorities. I feel like before, even if that was something that was my to-do list, it's on my checklist, my needs and the things that I have to do now for kids and for family, it's like definitely on a different level. So that there's definitely going to be a lot of apprehension and hesitation when it comes to even approaching or like putting that as a checklist to do thing, you know? So yeah, it's definitely a different playing field.
Great. Thank you, Mariam. All right, I think we all said, and yeah, if anybody has different idea, still you can share.
So I will just add, this is Marianne one more time. I will just add right now, I know the flu season is coming, and probably that's why you're discussing immunization. I would say that it's important right now to realize the fear around that and inform people about what you guys are doing to ensure, or others are doing to ensure the safety of getting immunization during the COVID. Thank you.
Great, that's great. Yeah, if safety is important during this hard time. So, Jean, do you want to say how we do about how is our process goes through during this time?
Yeah, I just want to mention, you know, we are taking every safety precaution to keep people safe. As far as our cleaning processes go, our mask wearing, you know, everybody that enters is asked to wear a mask. We're doing safe spacing. We have a lot of employees working from home to keep people out of the office. We've implemented drive-up testing where now you can wait in your car for your appointment. So we're minimizing people who come into the office. So if they're at high risk, if they have a chronic disease that makes them more susceptible to COVID-19, we're doing telehealth visits. So we can do the visits either by phone or by video. You don't have to have any fancy equipment. You can just call on your cell phone or on your regular phone. It's really easy to do. We've also implemented use of our patient portal. So you can go online, you can email your doctor a question, your doctor can email you back. So we're really trying to give people other ways to access us without coming into the building. So even if they need those immunizations, maybe that's something that they could make an appointment, you know, over the phone to talk to their doctor about that. And then, you know, we could make sure that, you know, even one of our newer locations, like our Whitehall Yearling High School location, it's brand new. We don't have a lot of patients there. So that it's a really small clinic. They wouldn't have to wait in a waiting room with other patients. It's a great way to go if you want to avoid being around other people. So we have lots of options for people to ensure that we're keeping everyone safe.
Thank you, Jean. Any questions? Any other questions so far? All right. Okay. Thank you so much. Somebody want to say something?
I just want to say thank you all for taking time out of your day to participate in this call for this really important topic and what we're doing to make a difference in the Somali community. We want to work with you to see what are the best ways to reach out to people. And this is probably just the first of many conversations that we want to have in the future to make an impact in the Somali community.
Thank you all. Thank you so much. Thank you for joining us this morning.
Thank you, Father, for organizing all of this.
Thank you. Thank you so much.
Thank you, Papa. Bye.
Bye. Thank you.
Thank you so much, everyone.
Thank you.
A lot about that. The people are afraid to get